Kami sokong
What I can see from this GEG to be implemented, to be tabled in the next parliamentary sitting, I think this a little bit changes from the previous RUU or the bill tabled by previous minister. So I think this one they had adopted few. I think this is a suggestion by many parties, stakeholders. Then brought to do the PSC meeting. So they discussed there, I think agree together. So I think this time they will come up what is already agreed by many people. So I think this is what should be agreed now. I think for those who still not understand of what is the GG, I think they can look back. The bill is more to the policy, the general policy, but the implementation very detailed. I think they will implement it a bit later. So there will be educational, I think enforcement, educational activity to make people understand how to implement it, where to sell, how to sell, then who cannot buy. So if they understand the GG is not only for those born after 2007, not before that. I think if they are worried about the business, about the customer, they still have customers. Those born before 2007, I think they can still sell to them. Yeah.
Right. We already have laws in place to stop minors from buying these things as it is. So what is going to change with GEG?
Okay, the GEG will. This is a new policy that make them, even after 18 years old, they cannot buy. So we are preventing them to create a new generation because currently, even before 18 now, they are smoking, they are vaping. So after 18, they are waiting for the legal age for smoking and vaping, but they already addicted with nicotine. So it's difficult for them to decide whether to stop or to continue because it's already addicted. I think it's not fair. That's why we want to make them totally free from nicotine, prevent them early, then continue free from nicotine and being addicted to smoke or vape. So it's a different thing. Before this, only before 18. Now, it's every year, 18, 19, towards the end, because it's a new generation that we want them to stop. We want to create new generation because if not, I think it will not have our prevalence to bring down the prevalence from 20% down to 5%.
Do you think that the tabling of GEG will get the full support from all the MPs? Do you suppose that they will get the full support?
I'm confident that the bill will get support by the majority, not all of them, because of course there will be opposition, maybe some people not agree, but it's already discussed in the PSC by partisan. Both parties are there and come out to the meeting of the cabinet. Cabinet agree. I think most cabinet will have a lot of parties there as well. So when they bring to the parliament, I think we have a lot of parties also there. So we get a simple majority, at least, if not 2/3 of the parliament.
Why is it so important right now?
I think this is already due. We have a lot of problem with the vape, smoking issues still not prevalence not coming down. We have a lot of complication because smoking. Effect to our country, the economically, the finance, the cost of treating the patient due to the complication of smoking very very high. Why we only gain half of the from the taxes. So I think we should have proper act. We don't have from previous year. We don't have many. We only have a small regulation under the Food Act, but we should have proper act that govern both smoking product, cigarette and also vape.
Okay, when it comes to intervention programs, there doesn't seem to be many, especially in schools, and it hasn't worked. Obviously, it hasn't worked over the years. You see, teachers are also smoking. You see, students are also smoking. It's quite openly accepted as a normalized behavior of teenagers. So, What do you think is going to change? I mean, is the health ministry ready to intervene? Does the health ministry have to step up its effort to intervene?
Yeah, I think with the GEG, when successfully implemented table, I think there is a momentum that we can escalate more activity, evocation and awareness in school especially. We are doing that previously. Now also, even my place, I am in the UM, so we are doing at school with the medical student, and also we bring to the schools. We do all throughout the year. So I think when we have this GG, I think it will give us a momentum to do more awareness to create, because we are protected with the bill, with the act, we have a laws. Now we need to do more in the education and awareness as well.